The election is a really stressful time, and everyone's talking about election anxiety and taking care of yourself during the election. But what we're not really seeing people talk about is the effect of election and maybe election stress and anxiety on fetal development, especially fetal brain development. So we're going to talk to you today about how that could happen, and at the end, give you a couple of tips to help maybe mitigate or improve some of those effects for your baby. I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And this channel is Medical Mamas. We're here to give you the real deal information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Houston. Okay, really big deal. Election is really stressful for a lot of people. And we're seeing that. I mean, I'm feeling it myself. Feeling some election stuff.
I mean, it's all over social media too, like how much anxiety people are going through with this election, and not even just the election, right? Like the outcome, like then what's going to happen, and where are we going to be in that moment? It's going to be even more anxiety.
Right. So if you're pregnant, we know that you're really trying to care for yourself, care for your baby, make sure that you have a great outcome in your pregnancy. And we know that the election and the election stress and anxiety associated with it can impact fetal brain development.
And I think it's important to add in that this affects fetal brain development, but also if you have a little baby, like a newborn or even kids, you being stressed and anxious and stressed for like prolonged periods of time, right? Not just like a week or something, but being anxious can also affect your child's development.
Absolutely. Yes. So maybe you want to talk a little bit about like how stress affects fetal brain development?
Yeah. So when you're pregnant, there is a hormone that is very prevalent called cortisol, and it has a lot of important effects in pregnancy and in baby's development. But when somebody is really stressed for a long period of time, or they're anxious, or they're depressed, this level of hormone doesn't fluctuate like it's supposed to.
And it can be really high.
And it can get high and it can stay high. Whereas in a normal individual who is mentally healthy, this hormone kind of fluctuates throughout the day and impacts them according to the levels. So in somebody who is not mentally healthy, if they're very stressed, anxious, depressed, this hormone level is abnormal, and then that affects the baby's brain development itself. So this hormone is very important for how the baby's body is developing, but also how the baby's own brain is developing in terms of regulating their cortisol levels too.
Mm-hmm. And we'll also just add that it isn't really, for me, fair to say like someone who's mentally healthy or someone who's mentally not, because I think it's normal to have a stress response to stressors.
Absolutely.
Right? So we know that people who are mentally healthy can still have impacts on their fetal brain development. So this really impacts everyone. And that chronic level of stress that's happening over these weeks, over these months leading up to the election and everything can impact people who, don't have mental illness.
Right. So in studies that have looked at this, where babies have been impacted by maternal stress, it's long-term stress or long-term mental illness. And so the shorter amount of time that stress or mental illness is going on, the less risky it is in terms of having impacts on baby's brain development.
Absolutely. So that's why at the end of the video, we're going to talk to you about a couple of things that you can do to help lower your stress levels, to feel better at this time, and to take care of yourself and your baby. Let's talk maybe first before that. Let's talk about maybe the long-term effects of what can happen for a baby when they are presented with a lot of maternal stress.
Yeah, so baby's brain, like we said, is developing while baby is inside of you. Also, once baby is born, their brain is developing at a very rapid pace in that first year. And so mom's mental health is very impactful on baby's development and growth. So let's take it back to during pregnancy. That cortisol level that we were talking about affects the baby's what we call HPA axis, hypothalamic pituitary adrenal axis. And that is what kind of controls our stress levels. So when that is dysfunctional, when it's not working the way it's supposed to, we feel more stressed, we're more predisposed to depression and anxiety. And so you can imagine that a baby later on in life that had this abnormal development or these abnormal cortisol levels can then be at higher risk for mental illness later on in life. We also see that the baby's part of the brain called the amygdala, which is really important in kind of reaction and emotions. And what else is the amygdala?
It's like regulating like big emotions, really.
Yeah,
The stress response.
the stress response too. So that actually develops or is more likely to develop abnormally in a baby who is exposed to maternal stress and mental illness as well.
So we see kind of the downstream effects of mom stress impacting baby, and then baby might be more prone to not respond in a like productive or healthy way to stress, and kind of how that can be passed on. So yeah, it's really important to regulate your stress and to help take care of yourself. Let's talk about how they can do that.
Yeah, so let's say that you are experiencing a lot of stress around this election time and it's prolonged stress, or you are having more anxiety or depression. There are things you can do to help that stress and anxiety that will then help decrease the risk of this affecting your baby's brain.
I think one of the most important things is to set boundaries.
Boundaries are so important.
They're so important in everything. I think we probably mentioned this in every single video. But we're talking specifically around boundaries of like, is talking about this or consuming the media around, the election or watching on election night. Are these things helping you feel calm and peaceful, or are they contributing to that feeling of like feeling stressed out? And if you are feeling more stressed about consuming that media or talking to people in your life about the election, maybe we will set some boundaries around that and do something else instead. Some examples, maybe like what people could say.
Obviously, like in terms of social media, like just block the accounts that are really big into that stuff if that's triggering to you. But with friends, something that you could just say is, hey, this topic is really hard for me right now. Can we maybe talk about something else? And it's totally fine to set boundaries with friends and with family. And if they don't respect those boundaries, or if that makes them angry or defensive, that is on them. That has nothing to do with you. You're not doing anything wrong by setting boundaries.
Right. And in fact, you're probably doing something great, right, for you and for your baby and your children.
So number 2 thing that you can do to help reduce stress and anxiety is lifestyle self-care type changes. And we talk about this a lot in our videos too. So definitely check out our other videos in terms of more details on this. But things like sleep, getting good nutritious food, making sure that you're moving your body, making sure that you're
doing hobbies that you enjoy, kind of just finding things that give you that like
feeling and and help rejuvenate you.
Yes. And so I think the third thing we can talk about is considering treatment. If this is really impactful for you, consider treatment. That could be medication, that could be therapy, that could be, anything kind of in the realm of seeing professionals that can help guide you in making decisions about how to move forward and helping yourself the best.
And as we talked about in our other videos, there are, risks associated with treatments, but compared to the risks of mental illness and chronic stress, those things, treatment's less risky for baby's brain and health and development than exposing baby to all that chronic stress and anxiety.
Right, exactly. Well, we hope this is really helpful for you, that you will integrate some of the things that we talked about here at the end of the video into your life to help yourself and help baby. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.